Hi everyone, my name is Eric and I will be showcasing the functionality of the Heart Health Imaging and Recording System. This is for SER 460 Homework 2. So this software helps heart imaging labs keep patient records and allows patients to view their CT scan results. We can go ahead and start running this by using the Gradle Run build. Just give it a few seconds and as you can see the main UI pops up. So this is the home screen of the Heart Health Imaging and Recording System. It provides four options: the patient intake view, the CT scan tech view, the patient view, and the doc view. Each role clicks their button to access the tools they need. So for the first one, the patient intake view, here the receptionist collects patient details such as name, phone number, health history, and insurance ID. Once the form is saved, the system automatically creates a unique 5-digit patient ID number. This ID will be used to connect the patient with their CT scan results. So for example, we can use my name, Eric, last name Sanchez, esanc108 at asu.edu. Phone number, we can just go ahead and make one up. Um, There we go. And as you can see, it's going to save it into a 5-digit unique ID number. And if we go here, we can go ahead and see that it has been saved. Going back, we can go and use the CT scan tech view. And in the CT scan tech view, the technician enters the patient ID and records the CT scan data. They save both the total axis and CAC score and the vessel level scores. So it's going to record the LM, the LAD, the LCX, the RCA, and the PDA. And this creates the CT scan report linked directly to the patient. So if we put the patient's ID number, we can go ahead and start filling this out. So for the Atkinson CAC score, we can just go ahead and put 250, LM 50, LAD 100, LCX 522, RCA 300, PDA 200. So we can go ahead and save that. And that is also going to create a unique ID for those results. As when we go back here, we can go back and in the patient view, the patient can go ahead and see the results of their lab results. So we can go ahead and get their patient ID number. The patient will go ahead and put that number here, and this should load. As you can see, it does. It loads all of the results. Going back, the doctor view can go ahead and put the patient ID, and that should also load the data, and then can determine the risks of if they would have for heart attack. So as you can see, because of the accident CSC score of 250, they have moderate amount of plaque, which is a high risk of heart attack. As you can see, this right here shows which demonstrates the full flow from intake to technician entry to patient access and to finally doctor evaluation and risk assessment. It ensures that every role is supported while keeping patient data connected and accessible. Thank you for watching. Thank you.